Okay, good evening, everyone. Welcome to Ristal University. My name is Doki Simon James Korsuk, and I shall be taking you through this course unit of Operations Management in Healthcare. First, our learning objectives. By the end of this course unit, should be able to define healthcare operations management, understand the key functions of healthcare operations management, explore the goals of operations managers in healthcare facilities, and identify trends in operations management in healthcare. By definition, operations management in healthcare refers to a process of systematically planning, organizing, and controlling healthcare processes and resources to achieve organizational goals and efficiency. It plays a pivotal role in the competitiveness and performance of healthcare organizations. What does this definition tell us? Uh, I look at three keywords here. Okay. First of all, we are organizing healthcare processes through a systematic planning, organization and controlling of the processes. At the same time, we need resources to be able to achieve our organizational goals efficiently. In every healthcare setting or any organization, normally we have set goals that we are working towards. But how do we achieve those goals? It is through these processes. It is not like a linear pathway, but it is a complex process of different departments working together to be able to achieve that goal. And this one tells us why you find one health facility or one hospital might be different in terms of others simply because of the performance dynamics involved. Okay, and this is the competitiveness we talk about, and this is what definitely makes uh, organizations or even health facilities and hospitals vary from each other because the setup of the organizational structures might not really be the same compared to others. Okay, let's look at the scope and objectives of operations management. Basically, operations management in healthcare encompasses a wide range of functions, including resource allocation, as we already saw it, processes optimization, and quality improvement. The objectives are to enhance patient care quality, optimize resource utilization, and reduce operational costs. Once again, in every healthcare setting, our main target is always that patients get the quality care that our project has specified. However, we need to be able to provide this quality care within the optimal resources that we can be able to provide. At the same time, we also need to be able to achieve this uh, quality patient care by using reduced operational cost. We know purchasing healthcare is very expensive, but whatsoever the case, within the definition of our quality care that we plan to give in this particular project, we need to make sure that we have to minimize operational costs. Otherwise, we shall enter into a waste. At the same time, sometimes not even able to provide really the quality that we have previously mentioned in our project proposals. So, what are the benefits of effective operations management? One is it improves efficiency in services delivery. Efficiencies by definition means that uh, you are able to achieve, you are able to achieve the targets, the quality of care that you want, but using minimal resources. Okay, that is an efficient system. You should also be able to reduce cost through the streamlined processes. It enhances patient satisfaction and also enables quick responses to market demands. Healthcare processes and systems. So when we talk about healthcare process and system, we are basically talking about multiple actors, okay, such as patients, clinicians, administrators, management, who interact in a complex and dynamic pathways in the healthcare pathways. Also, healthcare processes depend on various resources such as the equipment, the facilities, the information, and medications, which may have constraints and uncertainties. So, what does this tell us? If we are to provide the necessary quality of care that we need, we first of all need to have, if this is a hospital, we need to have a better equipment, okay, the laboratory or whatsoever hospital equipment that we need. We need to have the facilities. We need to have a health information system that is properly captured so that we can be able to get informations and analyze and plan well for our project activities in trying to provide health. We need medications. We need to make sure we don't have drug raptures. Okay, but however, if all these are not being met in a dynamic system, then we might end up with some constraints. And once we have constraints, I mean, already our goal of our aim of achieving our goal is already compromised from any single step within these processes. Features of healthcare processes. Basically, we talk of four features. These are common to all healthcare processes. We talk of complexity, we talk of interdependence, there is variability, and there's uncertainty. Complexity, we talk about involvement of multiple stakeholders and intricate workflows. For example, we already mentioned in the previous page of how managers, clinicians, patients, okay, all these interact to be able to achieve the common goal. So we already see that it is not really a linear pathway, but it involves multiple steps with certain pathways that works in coordination, either to achieve this particular quality that we attempt to provide, or else we may not be able to achieve it if the workflow is not uh, to the maximum of what we expected. Interdependence means that all the systems we talk about, especially in the health sector, are integrated. Okay, one system is related to the other one, and whatever happens in one system affects the next process. Okay, so systems are integrated. This is what we mean by interdependence. Variability, we have varied patient needs and resource utilization. Patients present to us with different kind of presentation. The needs of one person may not be the needs of the other, and all this calls for different approaches, and this one calls for different resources that might be needed uh, for each particular case. Uncertainties, changing patient conditions and external factors. Uncertainty is one of the major issues affecting the healthcare system, as well as other systems even outside the healthcare. For example, all of us have seen what happened when COVID-19 came in. We have seen how health systems suffered under the COVID-19 pandemic, but it's not only just the health system. Okay, it affected almost every aspect of mankind. So whatever happens in the health system, or even outside the health system, at the same time affects the quality of care. So uncertainties is one thing that always systems have to be prepared for. Analyzing healthcare processes. Healthcare process analysis is the systematic examination and evaluation of the processes, workflows, and activities within the healthcare industry to understand, optimize, and improve the delivery of health services. I've put for you here in bold the processes, the workflows, and activities. We shall be talking more about this in the coming slides. So let's look at the methods of healthcare processes analysis. For today's presentation, we shall be discussing basically the 7 steps of the processes that are used in healthcare analysis. Number 1 is what we call process modeling and simulation. Number 2 is we call flowchart. These are visualizations, visual representation of processes. You might have heard already about flowcharts. We shall talk about them in the coming slides. We have value stream maps. Okay, these are detailed process maps for identifying improvement areas. We have cause and effect analysis. We have statistical processes control, lean principles, streamlining processes by eliminating waste. The aim of lean principle is just aim at maximizing outcomes but minimizing waste of resources. Okay. 6 is Six Sigma technique. We shall talk more about this. Is a data-driven problem solving and process improvement that employs statistical methods. So before that, let's look at the traditional methods of healthcare process analysis. By this, we are talking about traditional business process analysis methods, which involve mostly time-consuming and costly activities. This includes 1, discussion with workers. Okay, these are some methods that can be used irrespective of the 7 that we have looked at. Okay, we call them traditional methods that have been previously there. Document analysis. Okay, using observations or using subjective descriptions to be able to find more information on the healthcare process. So you're trying to use any of these to be able to make an analysis, either discussions, either you look at the documents and then you make analysis, or either you observe all how the healthcare system is operating, all the departments. You can start from patient, first of all, if it is a hospital, from the triage, it follows the far way to consultation and laboratory, pharmacy, and up until exit. So it just already that kind of uh, observation will be able you will be able to get to make your own findings based on that. And then subjective descriptions. Uh, all this will help you at least reach some conclusion, but however, they are not as better as compared to the 7 we mentioned in the previous slide that mostly we shall be discussing about in the coming slides. Okay, let's start with number 1, which is the process modeling and simulation techniques. First of all, process modeling by definition is the activity of creating a representation of a real-world process using a formal notation or language such as business process modeling notation, Petri nets, discrete events, simulations. So you might be wondering, we are talking quite a lot about business terminologies here. The point here is that most of these concepts have been used initially outside the healthcare. However, we found their use inside healthcare system very relevant. By the way, for your information, healthcare system itself is like a business entity where we are purchasing healthcare for the community. Okay, so what actually happened is that the government, okay, is putting money in place. This money is actually from us. We pay taxes, we do everything, and then the government finds a way of how it can purchase healthcare for us. So that's why still the notion of business applies here. You may also get to know that we have insurance companies. Okay, some countries already have national insurance company. If we look at within our region, Kenya, Burundi, okay, Tanzania, Rwanda, okay. We are still waiting from South Sudan and Uganda. So all these are arrangements that have been made to purchase healthcare for the communities. Okay, the next we are looking at process simulation. is the activity of executing a process model or a computer to mimic the behavior of a real-world process and observe its outcomes under different scenarios and conditions. Process modeling and simulation, the two can help us to understand the structure, dynamics, and performance of the healthcare process, identify bottlenecks, inefficiencies, and risk, evaluate alternative solutions and policies, and support communication and learning. So basically, this process help us to dive deep into our system and be able to monitor. It acts as a monitoring and evaluation tool for the health system. Number two, we look at the flow charts. This method uses graphical symbols to represent the steps, inputs, outputs, and decisions involved in healthcare processes. Flowcharts can help visualize a process sequence, logic, and interdependencies, and identify potential bottlenecks, errors, and inefficiencies. Okay, we shall look at a flowchart diagram. Maybe you will understand it better in the coming slide. So here we are. Let's have a look. This is an example of the flowchart we are talking about, and the example we are taking is our hospital as a basis, as a unit of analysis. Okay, so uh, we look at the start. The person arrives. Person is registered. A nurse attends the person. Okay, and then either after registration, this person is attended by the nurse, and then the health condition is recorded, goes to see the doctor. Okay, and then the flow chart continues. Okay, up to the point when the person leaves the hospital. That is after already getting prescription from the pharmacy, and then the person exits. Okay, so these are real world scenarios, things that happen. But when we put them in flowchart like this, it makes analysis quite easier. It makes more understanding. Okay, we visualize the process, and in the same way, if we need to analyze and evaluate this particular program, we can look critically at each of the steps, and we shall be able to know if there are bottlenecks, if there are delays. First of all, maybe patients are taking too long a time from the start up to the exit. Okay, more than 1 hour. So we try to find out exactly what are the points of delays. Okay, we can just go through all these steps, and then we shall be able to see what was wrong and perhaps how we can be able to improve it. Okay. Number three, we talked about the value stream mapping, in short BSM. We said this method focuses on the flow of value from perspective of the person or the consumer. It is a very important point. Actually, this one it focuses on trying to evaluate, okay, are the patients really satisfied with the quality of care we are providing? Okay. So value stream maps shows the value added and non-value added activities and information and material flows in the healthcare processes. Okay, this mapping can help identify waste, delays, redundancies, and if there are opportunities for improvement. Let's look at this diagram that is trying to illustrate the value stream mapping example. Okay, so here at the center we have the quick healthcare. Our aim is to be able to provide healthcare as quickly as possible as we can to our clients. But then, for us to be able to achieve this, many factors come into play. Okay, first of all, we look at the lead time, the processes time, and the delay time, and the queues and waiting time. Okay, what time really does a person take from the entry, as we saw in the start, from the entry up to the exit? Is it abnormally long? And if so, where exactly is the problem and what can we do? Is it at one point, or is the entire system that we need to do something? Okay. We look at swim lane mapping. Okay. So here, this is we look at horizontal and vertical cross-functional charts. The cost by department, and then the resources by department. The swim lane mapping is more of basically an analysis that gives us a measure of what costs are needed, what cost is needed per each department. Okay, to be able to execute the pathway. Okay, if we take the pharmacy first of all, what cost do we need there? If it is the laboratory, if it's a consultation. Okay, so this is the swim lane and mapping is looking at cost effectiveness. Also, we look at the cost here. We have activity-based costs and also resource-based costs. So we should be able to know, first of all, how much do we need for the whole process, okay, for the whole activity, and then how much resources do we need. So cost based on activity, and then cost based on resources. And then quality, we look at percentage complete and accurate, okay, uh, completeness of an activity, okay, and cumulative by, and then also we look at completeness by fabric. So if we look at our flowchart, for example, if we are trying to assess our quality that we already have perhaps in the definition of our project at the initial start, at the start of the project, the quality we need to see in each sub and every department, okay. This one, uh, we look at the pathways, the interconnecting pathways between consultation, uh, maybe triage, consultation, laboratory, and then the pharmacy. But then we also need to look at the activity, and then we look at cumulative quality. Here we mean that, okay, if the for example the consultation is really done to the quality we need, and then also this person goes maybe to the laboratory, and then testing is done according to the quality we need, goes to the pharmacy and is really getting the real medication. This is we add this one, and this is called cumulative quality, okay. And then by fathway is already the whole fathway, okay. So it is really a step by step processes that adds to the measure outcome that we need. We look at the resources, okay, resources utilization, how are resources used at each department, the resource capacity. Here, when you talk of resources, we talk about both the human resource and also the material resource, okay. Resource usage and balance. So if for example, if we talk about the human resource, okay, the resource capacity, we'll be looking at, are we really having the right people at the right place, perhaps at the right time, okay, from consultation up to the exit, all those departments. Query handling. Query here refers to in case like we have some proofreadings, things that we need to first check if really for accuracy, okay. For a normal system to attain a better quality, obviously there is need to be able to check. But then how long do we take to be able to check all the queries per system? Because also the more that we are delaying in our query system, that means also uh, the more time we spend also affects the whole system. But it is important, yes, but how much time do we take there? Okay. And then divergent flows. This one is a point of decision making. Okay. We have convergent and divergent decisions. So it also measures and automated the demand calculations. What do we need? What does the system need? For example, uh, for it to be able to function correctly. Okay. And then we look at iterative process. This is a process to iterate, just is to do it repeatedly, and the point here is to be able to check for quality, to remove errors. So you do something repeatedly with the aim of improving it. Okay. So we look at how often do we do this, how many times do we do this, and then or also look at what are the linking activities. Okay. And then this one leads you back to the lead time. So it becomes a cycle we can use to assess, and will be able to give us an explanation of how best our system is doing, or maybe what we may need to do if it is not going as planned. Number 4 is the cause and effect analysis. This one is basically used as a problem solving tool, but the magnitude of the problem can be diverse, that cuts across the entire system. Okay, this method uses a piece-bone diagram to identify the root cause of a problem or an outcome in a healthcare processes. His name Ishikawa piece-bone problem analysis. Ishikawa, as you can see, this is a Japanese name. This was the first one who first described this model. Initially, again, this model was used in the manufacturing industries, but it has become a model of importance in healthcare, not just healthcare, but even in business management. It fits any kind of a complex system because it helps us in analyzing problem and be able to find better solutions. Alternatively, we can also use the problem tree analysis. It serves the same function. So if you use the Ishikawa piece-bone, you don't need to use the problem tree. If you decide to use the problem tree, still you can analyze it fully. You don't need to, to, to use the Ishikawa piece-bone analysis, but you are free to choose any. Or maybe you can use both, but of course they give the same findings. So the piece-bone diagram consists of a central spine representing the problem or outcome and several branches representing the categories of possible causes. Each branch can be further subdivided into more specific causes. Okay, the cause and effect analysis helps find underlying factors affecting the performance of a health care process. Let's look at the Ishikawa cause and effect model. So why we call it a piece-bone analysis? Uh, the description, the structure itself looks like a piece, okay, where the problem that you have seen and that you intend to analyze is the head of the piece, okay, is the head of the piece. But then what caused the problem is from behind, from the tail, okay. So the midline is just like, if we look at the tilapia piece or any piece generally, the midline is just like the vertebral column where the bony structure, the main vertebra in the middle, but also we have the other bones, okay, connecting to the main structure. So in Ishikawa's structure, is trying to tell us that what we see as the backbone here is the root causes of the problem that we are seeing here, which is the head. Okay, so several factors could be primary, which are the primary causes of this problem, are the main one. So these primary causes are the, for example, for this diagram, we look at the cause here, and then we have the effect. So the cause is the primary causes. We look at equipment as a primary cause of this problem, processes, okay, the people, materials, environment, and then the management. So let's take, for example, this is our whole healthcare system, and we have problem here. Let me say, for example, the problem is that we have observed that for the last 1 month, patients take an average, a patient takes more than 1 hour, when previously a patient doesn't take even 30 minutes to go through the whole system. So we need to understand now why we are seeing this, why patients are taking more than 1 hour from entrance to exit. So we have to check this from all this. Uh, the equipment here, we are looking at our hospital equipment needed in the diagnostic process for the patient. Okay, and then our processes, the pathways, okay, the triage, and then the phase and flow generally, step by step. We look also at the people. The people, how competent are they? Okay, is there something wrong at one point? Is there where maybe the delays come because of a staff problem? Okay, and then we look at materials, generally materials that are needed to contribute to the whole of this process. Okay, for example, if this is an ANC visit, do we have enough PP machines for these pregnant mothers coming? They are waiting. The line is too long. Is the machine working well? So quite a number of things. We also look at the environment. Are there factors, okay, that are causing this kind of delays that are related to the environment? And we also look at our management. Okay. So already by looking at all this, we will have already reached our problem. Uh, this is the same diagram, except that we have expanded it here a bit. What you need to see here is that the, the primary root causes can also have some secondary root causes. So if there are other root causes alongside the primary one, this one become secondary root causes. Okay, as we can see here. Okay. Even on top of the secondary, we still have tertiary causes. So you have to analyze deeply. Okay. If the machine is the cause of the problem here, is there any cause here that is relating to the machine that is making the machine not work well? Any secondary cause? Or is this secondary cause also attributed to another tertiary cause? You see, this way you will always and obviously be able to get better findings. Okay, we are done with the Ishikawa model. Let's look at our problem tree analysis. The problem tree analysis basically works the same as the Ishikawa's model. However, here it always says that what we see up as the roots, which is some, I mean, as the leaves of the tree, which is always visible, you can really see it, which is the effects, just came because of a problem. There is a root cause. There's a root cause down there. Okay? But the major problem that you always will be able to see is the trunk. The trunk of the tree is your core problem. And then this core problem is leading to many other effects that already you know they are coming because of this core problem. So in the tree analysis, your focus is the trunk. Your major problem, put it at the trunk level. And then you will go down asking yourself the five whys. Five whys. Okay, why is this problem happening in your trunk? What has brought this problem? You are looking back at the root causes. You apply your five whys to the root causes. Because the effects are already manifestations of the problem, which obviously you already know. They are like the symptoms. Okay, so let's look at the diagram on the right, which is having some example. So here our core problem uh, is an encroachment into a protected area. Okay, there's an encroachment into a protected area. Okay, this is the main problem. But then you need to be able to understand why there is this encroachment going on. Then you go down to the root cause analysis. So you ask yourself the five whys, okay? And then you found that there was insufficient natural resource base. Secondly, there's also disputed land ownership. This example is outside help, but still just for you to be able to build up the memory, you can use the same example. You can take it to any setup inside your healthcare system. Okay, and then we find that there is a weak PA law enforcement, and then there is displacement of groups outside the PA. So just again, we still feel that's not enough. We come and so we have found this for up here, but we still go further, another step down. The other Y will give other steps. So for each of the four steps that you've already found, you need to do the same. Another Y, you go further down. Another Y, you go further down. After doing this, you will have already gathered enough root causes problems. Okay, and then this will be able to explain. And then even after the core problem, you'll still be able to categorize the effects. The effects might come, in various steps. Others come first, and then these other ones leads to another one, and then it goes and then it goes and it goes. So this is how we can be able to use the tree problem analysis. I still repeat, what is important is put your problem as the trunk, apply the 5 Ys to the root, and then you can look at the effects basing on a sequence of occurrences of events. What is important with both the problem tree analysis and also the Ishikawa model is that we already have templates online that you can just download. They are basic templates that you can already enter. They even have columns. You just enter and it helps you just work on this quickly depending on the problem that you have, and then you will proceed. We have the statistical processes control, SPC in short. This method uses statistical tools and techniques to monitor and control the variation of quality of healthcare processes. I may not talk so much about this, but already we know the statistical models we use. Okay, we look at probability sampling. We look at many techniques, regression. Uh, Statistical regression models, because already they help us interpret data to give meaningful information for planning purposes. So basically, this statistical process is one of the analysis tools that we use. It involves collecting and analyzing data from healthcare processes. Every day we record details from patients. We have our hospital registers. Why are we taking these details? Because we are using these details, this data, to analyze them and be able to visualize trends and make a planning and be able to plan ahead. Okay, what are the common morbidities in these facilities? How can we approach this? How much drugs do we need? And then we can predict uh, future trends. If the data falls within the control limits, the process is considered stable. However, if the data falls outside the control limits, the process is considered unstable and out of control. But by this, what we are trying to say is that already at the start of our project, we already have a plan, a kind of strategy. Okay, we already have performance targets after that we have already set. So we said by the end of this year, we need to decrease the morbidity, of malaria cases by a certain percentage. Okay, or by the end of this year, we need to see that maternal mortality decline in this facility by a certain percentage. So we shall follow this trend, we analyze this data, and really, at the end of the analysis for this year, we have not achieved the set target. Okay, then we start to see why we have not achieved it. Okay, this is how statistics help us here. And number 6 is the lean thinking. Lean thinking is a philosophy and methodology that aims to eliminate waste and improve customer value. Here we are trying to be efficient. We minimize waste while improving what? The value. Okay. In healthcare operations, lean thinking can help to optimize processes, reduce errors, enhance quality, and increase efficiency. What are the benefits of lean thinking? Uh, Define the value from the perspective of the patient and other stakeholders. Identify and map the value stream for each service and product. Eliminate or minimize any activities or resources that do not add value or create a waste. We are actually trying to minimize waste. Implement continuous flow and full systems to deliver value when and where it is needed. Pursue perfection through continuous improvement and problem solving. Okay, tools and techniques of lean taking. We talk about the 5S. Okay, we said the 5S is a system of organizing and standardizing the workplace. You will see more about the 5S in the coming slide. Okay, and then we also have what we call the Kaizen. We have the Gemba, we have value stream mapping, we have Kanban, we have Poka Yoga, and then Six Sigma. We shall explain all this in the coming steps. They sound a bit strange, but actually you'll get to realize these are already common things that you might have been using already in the hospital, in the setup that you are in, but except that here they are coming in a different terminology. We shall see in the coming slide. So a Kaizen number 2, this one is a culture of continuous improvement and employee development. Okay, so here we are looking at how best do we improve our employees, and we do this through continuous improvement. If you have been in a clinical setup, we always have those continuous medical educations every day. Okay, we even conduct mortality audits. The aim of all this is just to be able to improve so that next time we can learn from what we have not done better. Okay, this is what we term as the Kaizen. We look at the Gemba. It's a practice of going to the actual place where work is done to observe and improve. Here we can talk about the intensives, or perhaps even the internship is more. But here, at least you go to be able to see how things are done. You go to where you have not been able to places that you are not capable, you don't have knowledge about, but your aim there is to be able to observe and be able to learn. Okay, is the Gemba. Value stream mapping is a tool for visualizing and analyzing the current and future state of processes. Okay, so this one gives us some predictive value for the future. Kanban is a method for controlling inventory and production based on demand signals. We always use this a lot. If you have been in the pharmacies, in the pharmacy, obviously, we have quite a number of tools there that we use, and it's in the category of Kanban, like the drug monitoring sheets and quite a number of inventory that we do in the pharmacy. Poka Yoka is a technique for preventing or detecting errors or defects. Okay, we shall look at this. For example, if we look at the pharmacy itself, okay. For example, we have the thermometers that are always there to monitor temperature, and they have alerts. Okay, they have colors that changes. Okay, all these are techniques that are just there to be able to remind us so that we know that something is going wrong. Okay, if you are in the API department, you are using iStacks that are able to indicate, okay, the temperature within a vaccine. So all those kind of things fall under this FOCA IOCA kind of grouping. We look at the Six Sigma. It's a data-driven, this is statistical technique that I mentioned, is data-driven approach for reducing variation and improving the quality. Okay, let's look at the 5S. The 5S is a workplace organization method for sort, set, sign, standardize, and sustain. Okay, it is used to improve efficiency, safety, and productivity. So it is here, sorting is just like sorting. So you have to organize your things. I will still use the pharmacy example here. Okay, if you don't sort the drugs, you are the pharmacist and it is not well sorted, that means we are going to lose a lot of drugs. First of all, the time that we need them, we may not be able to locate them. And then the time is going, a person is waiting. You have to set things in order, organize and label items for easy access. Okay. The sign here means that you have, it has to be clean and maintained. You clean and maintain the workplace. Why? Of course, if it is not clean, we know it's already a risk to whatever. If it is the medications and the pharmacy is not clean, it's already a risk to whatever is there. Standardize, establish procedures and standards. Okay, that can always be followed and sustained. And then sustain is continuously maintain and improve. So all this has to continue. It has to be a sustainable process from the start up to the end of the project. Practical examples of the 5S, such we say regular review and remove expired or unused medical supplies, already like the drugs. This is what the pharmacist does. When drugs are due to expire, we make sure that either we order the clinicians to prescribe more, or otherwise we give them as a donation even in 6 months in advance, because we are able to predict that the consumption rates at this facility might not be able to finish this drug. So all this needs a prior kind of planning. You have to set in order, label the shelves, the storage bins for different categories of supplies. Okay, for example, the drugs in the pharmacy. Sign, establish a cleaning schedule and keep supply rooms clean. This is self-explanatory. Standardize. We should have SOPs, standard operating procedures, for supply room organization, and regular train staff on these procedures. Okay, always staff should be aware, and all the staff working here should be aware, so that in case another staff is not there, the one who is around is already aware. He knows whatsoever to do in this particular setup, and then we have to be able to sustain the system. Let's look at the Kaizen. Kaizen is a Japanese concept emphasizing continuous improvement through small incremental changes involving all employees. We can see how generous they are here. Okay, that means for all the employees that are in the system, we always have to make sure that they are developing. Okay, they are getting incremental changes. They are into the system, and every they should be aware of almost most of the steps in the system, because these are people who will contribute ideas. And we know that if all employees own the system, if they know what what is supposed to be done at each and every step, that means it will minimize errors and the system goes well. Okay? Employee involvement in problem solving, regular brainstorming and idea sharing, and then emphasis on teamwork and collaborations. All this contributes to the outputs. Uh, we have a practical example here. Kaizen practical example is nursing shift handover process. It encourages nurses to regularly gather for a brief discussions to identify issues and improvement opportunities during shift handovers. Not just nurses, anyone, doctors, clinicians, midwives, whatsoever. Okay, we know that this handover process we are doing are always important, and it helps to minimize errors. This is already an example of the Kaizen that we are talking about. Okay, provide a suggestion box for nurses to submit ideas for process improvement, conduct regular events, focus on improving the shift handover process involving nurses, physicians, or other relevant staff. Those are the examples. Let's look at Gemba. Gemba is observing, understanding, and improving processes firsthand at the workplace. The key benefits are identifying issues and inefficiencies, encouraging direct communication, promoting problem solving at the source. In our clinical settings, we have been doing this quite a lot every day. We have our morning meetings, we have our routine meetings, we have our emergency meetings. Those are all categories that falls under this. The point here is that once we see something unusual, we need to come together, okay, and be able to educate each other on that thing and be able to minimize its occurrence, because we know it is taking the project astray. Okay. Hospital administrators and process improvement teams regularly visit the emergency department to observe patient flow and identify bottlenecks. Conduct Gemba works work to emergency department staff and nurses about their challenges and suggestions for process enhancement. Use Gemba Insight to design the emergency department layout and optimize triage process for better patient flow and reduce wait times. Well, next is value stream mapping. The value stream mapping BSM is a tool used to create a visual representation of a process. This one helps in identifying waste, bottlenecks, and improvement opportunities. It is an automated machine, actually. Key components, we have current state mapping, and then we have future state mapping, and then identify value added and non-value added activities. So basically what this machine can do is able to evaluate our current status, mapping of the current status of the setup. But also it can be used to give us a prediction of how future mapping will look like based on current findings. Okay, and it helps add value or non-value added activities. It helps us in identifying what is adding value to our system and what is not adding value. So it's really a very important tool that we can use. A practical example of the BSM. Let's look at patient discharge process. In this patient discharge process, create a current state value, a stream map of the patient discharge process, highlighting each step and the time spent at each stage. Identifying bottlenecks and areas of waste such as delays in discharge, orders, or paperwork. Develop a future state map with streamlined processes, electronic documentation, and a focus on patient education. Implement a focus ecosystem to ensure instruments are never left behind. So basically, what we are trying to say here is that, for example, when we talk about the patient discharge, this happens quite a lot in facilities where a patient is already discharged, but sometimes the paperwork is not complete. Okay, during what round the patient is told, okay, you are now doing well, go home, you are going on this medication, but you find from nowhere delays coming. This discharge medication is not even given, and then this person is just here waiting. Perhaps at the same time, the person has already called for transport because he's discharged, but paperwork is not finished. He has not gotten the take-home medications. So you see all these certain examples in this category. We have the Kanban. It's a method for managing inventory and production based on the demand signals, ensuring a smooth workflow. The components, you have the Kanban cards or signals, okay, the pull system where work is initiated only when there is a demand, and then the visual boards to track progress. We have a diagram here, an example, a chart here, an example of a Kanban board. This one basically is just like the way you plan your to-do list, okay, your day-to-day activities, so that you don't forget. So you have started your day, you have to start the to-do list. You know, today I have a number of routines. At this time I have this, at this time I have this, and then you can just put a list because our brains sometimes forget. So when you have a to-do list, you will always check on it day by day, and then you are reminded there are specific important things that you need to do first. Okay, so this is basically if you look at this one here, you have the to-do list in progress and then done. So it's just like self-administration in trying to execute your activities. But this kind of tools makes self-management and management of your teams and activities quite easily, and it helps the process. Practical example, pharmacy medication management. Implement a Kanban system in the hospital pharmacy to manage medication inventory. Use visual signals to reorder medications when the stock reaches a predefined minimum. Okay, and then ensure medications are restocked based on usage, reducing medication shortages and waste. So you already have a layout that guides you on this. For karaoke is a technique for designing processes and systems to prevent or detect errors and defects. Example is error proofreading machines. This is one of the machines you are seeing here that is being used in doing this. Oh, visual cues and warnings. Okay, automated sub op systems. Okay, some of them are just automatic. Okay. Practical example: a surgical instrument count. I think this will go well with most of you who have been in the clinical setup or perhaps have been in the theater setting. Develop a system in the operating room where surgical instruments are counted before and after each procedure. I've ever seen some wonderful and important x-rays taken from patients bearing forceps that had been left during a previous surgery. Somebody came and then a procedure is done, and then abdomen is open and then closed, and then there's a device inside. All of a sudden, this person goes home and is presenting with continuous pain, even after the operation wound has healed. When the person is returned and then an X-ray is done, you see a metallic object very clearly showing inside. All these ones happen. How do we minimize that? The Poker can help. We use electronic counters or barcoding to prevent the incidental leaving of the instrument inside a patient's body. Okay? Or traditionally, basically what we do is that you should always know how many forceps did you go to in the theater. Did you go with in the theater? And then before uh, the procedure ends, you should also be able to count. Do I really have everything in place? Because sometimes really it's easy to forget. Okay, let's look at our Six Sigma. Sigma, as we talked about, Six Sigma, you can see the Greek symbol here, is a data-driven approach for reducing process variation. The key principles is to define, measure, analyze, and improve the control. We can see here the Six Sigma. We have define, okay, measure, analyze, improve, and control. This is what it does. It uses a statistical tool and analysis, and then it targets a process capability. Targeting a process capability of Six Sigma, 3.4 defects per million opportunities. Let me explain a little. The Six Sigma, as we said, is a mathematical. It's a mathematical concept that uses that uses a standard deviation. Okay, the symbols here is a standard deviation around the mean. So basically, okay, so basically what this machine uses, the main aim of this machine is to make sure that we are working within the limit of 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 of, of certainty. We are certain of having less errors in our system. Okay, so it measures the variation from the mean, the level of the standard deviation from the mean, and it uses six standard deviations. That's why it's using six. So like we know one standard deviation is one sigma. Okay, two standard deviations is is 2 sigma, and then 3 standard deviation is 3 sigma. But why we are saying 6 is because if we look at the normal distribution curve in statistic, we shall see that this 6 sigma relies on 3 standard deviations to the left, which is the negative side, and then 3 standard deviations to the right. So actually, the probability of an error occurring using the 6 sigma deviation is just a process of 0.000034. That's why they said 3.4 defect per million opportunities. So it's really a very minimal of a chance that we may have error. So it is always accurate, and we rely on it because this is a minimal margin of error. Like 0.00 and then point. I mean, 34 with up to six kind of digits. That's what we are saying for a million opportunities. Uh, we leave it there for now. We are not talking more about the standard deviation, but it's just to be able to explain to you how the principle of operation of this 6 sigma. The major point is that it helps us work with the certainty that we have minimal errors in our system. So the practical example is reducing medication errors. We apply 6 sigma principle to reduce medication administration errors. Define critical metrics related to medication errors, that is frequency and severity. Use of DMAIC methodology to identify root causes, implement process improvements, and also continuously monitor and control uh, uh, administration processes to minimize errors. The Lean Six Sigma, this method combines the principles and practices of Lean Six Sigma to optimize the efficiency and effectiveness of a healthcare processes. Okay, the Lean focuses on eliminating waste, increasing value for the patient or customer, while the Six Sigma focuses on reducing variation and defects and improving quality. So Lean Six Sigma follows a structured methodology called the DMAIC. We have already seen this to define the problem or the goal, measure the current performance, analyze the root causes, and implement solutions and sustain the results. Let's look at the Lean Six Sigma. Okay, it's the combination of the two globally proven methodologies. We have the Lean and then we have the Six Sigma. So the purpose of the Lean is to reduce waste. This is the main purpose. Is to reduce waste by streamlining the process. While already we talked about the Sigma, we said this one reduce defects by effectively solving problem. It is assuring us that the system is accurate. So if the system is accurate, then we need now to combine it with reduction of wasting. Okay? If we have accurate system, we don't need now to waste resources, and then at the end we shall get a combination of better results. Lean Six Sigma. This one accelerates the Six Sigma solving problem and also improving processes in a faster and more efficient way. Trends in operation management in healthcare. We have technology integration and patient-centered care. For the technology integration, we look at electronic health records, telemedicine, and remote monitoring. AI here stands for artificial intelligence. We know that artificial intelligence is taking over and is also becoming part of the important technology that we can use in healthcare. Okay, and predictive analysis. Predictive analysis, we can predict now. We can predict the future using probability. For example, if we look at the population estimates that we have currently, okay, most of these can be extrapolated from the previous census that the country has had. So all these are probability uh, techniques that uses this kind of intelligence, and it helps us to predict um, things occurrences in the future. Patient-centered care. Here we look at patient engagement and shared decision making, and then personalized treatment plans. With this, we have come to the end of our session. Thank you so much for being with me. Bye bye.